Hi everyone, Dr. Christina here with Enlighten Wellness Solutions, and thank you so much for coming to my channel today. If you haven't liked, subscribed, or shared any of these videos and you like this video at the end, make sure you give me a like, make sure you subscribe. I love having you guys come back, and when you subscribe, you get notified when I post videos like this. So I'm really excited today. We're going to be diving into a new class of diabetes drugs called SGLT2 inhibitors. Wow, that's a mouthful. But don't worry, I'm going to make it very simple for you. We're going to break down the pits and the pearls, the good and the bad, what to look out for if you're on this medication. So stay tuned because we're going to be going through 4 medications today and really helping you understand what you're putting into your body if you're on the medication. And before I start, I always like to give a quick medical disclaimer that while I am a pharmacist and a health coach, I am not giving you specific medical advice. I don't know your medical history. I'm not sure what medication you were prescribed. So please, refer any of those questions to your pharmacist or your doctor because they have a better picture of, why you're taking the medication, what some of the other, your medical history is. So, and if you want to read the full medical description, it will be in the description box below. So definitely check that out. And now for the good stuff. So we are going over 4 medications today: Invokana, Farxiga, Jardiance, and Steglatro. So like I said, this is a relatively new class of medications. In the last 5 years, there's been a new development in the diabetes world. We're used to seeing, as pharmacists, we see, metformin and sulfonylureas, and one of the other class of medications is DPP-4 inhibitors and GLP-1 agonists. So this class of medication is relatively new, and it stands for sodium glucose transporter 2 inhibitor. And that's just a fancy word for saying that what's happening is that this medication is blocking glucose reabsorption in the kidney and increasing the glucose that's being excreted. So whenever a person is going to the bathroom, they are going to be pushing out more glucose and thus lowering blood sugar. So that's how the medication works essentially. And I always like to describe, how a medication works because then you can see, what are some of the side effects to expect. And that couldn't be more true with this medication because since it's really helping the person to excrete more glucose in the urine, more sugar, you can expect urinary side effects. So some of the more common side effects, we're going right into the pits of the drug, are urinary issues. So UTIs, yeast infections, fungal infections, and this can be seen in men or women. So that's something to look out for. What I would recommend is to just stay hydrated, make sure you're drinking a lot of water. A lot of people say, oh, I hate water. I really don't like the taste. It's too plain. What I recommend is trying to spice it up a little bit. So you can add sliced cucumber, you can add in some lemon. A lot of people do the infused water, so you can actually just leave some berries, maybe some blueberries, blackberries, raspberries, and infuse the water so that when you're actually drinking it, you want to drink more. So I would recommend that. I also have a bottle that I bring to work every day, and I just keep filling it up all day. So those are just some easy tips to increase your water intake, totally aside from the drug, but I thought that it was helpful. So again, common side effects, dizziness, hypotension, which is low blood pressure, hyperkalemia is an increase in potassium. And you can see that with some of these medications. So again, keeping your doctor's appointments, making sure you're getting regular checkups and blood work is important because these drugs do alter your metabolites, and they can increase potassium in the blood. So you want to make sure that you're staying with your doctor's appointments, especially with renal impairment, with kidney dysfunction. The hyperkalemia, the increase in potassium is more likely. So definitely, stick with your appointments, make sure you're getting your blood work, and listen to your doctor. So now with Farxiga, there is an increased risk of bladder cancer. So if you have a history of bladder cancer in your family whatsoever, you might want to mention that to your doctor because he or she may not even want to put you on this medication because that is going to increase your risk for developing bladder cancer. That's something that they found. Some of the more rare side effects, pancreatitis and amputations, which this is an interesting one. It can occur in 6 out of 1,000 patients treated versus 3 out of 1,000 with any other diabetes medication. So they did a head-to-head comparison and saw that amputations were of higher risk with this class of medications. Now, again, something to think about, because this medication works on and through the kidney, your doctor might have to adjust your dose. So depending on what your kidney function is, you might be on a different dose than maybe someone else that has normal kidney function. So just some things to look out for, some things to mention if you're thinking about going on any of these medications. So that those are all of the pits of the drug. Now let's go into the pearls. So the positive things about the drug. So A1C, so that's the measurement of your blood sugar over a 3-month period. So it's interesting. A lot of people will know that they have a doctor's appointment and they are like, oh, I'm going to eat good for the whole week before I see the doctor. He's never going to know. Well, the A1C actually shows for the last 3 months what your blood sugar was. So if it's 7, then it's an average of, say, 150. I'm just guessing. I'm trying to remember the chart in my mind, but the doctor is going to be able to know. So that's really a global picture of what your blood sugar has been over the past 3 months. A1C drop or decrease when this is added to metformin, when any of these drugs is added to metformin, has a range from 0.4 to 0.7. So say that your A1C is 7, it's estimated that your A1C, if put on this drug, will drop to 0.04 from the 7. So you would go down 6.6, or if you're on the higher range, 0.7 drop, then you would have a 6.3 A1C after adding this medication and after a certain amount of time. You're not just going to have an immediate effect right away. Now, an interesting thing about these drugs, and specifically there was a study called the Canvas trial for Invokana. So if you're on Invokana, this was really interesting, and you actually might be on it for this reason. There was a random control trial, which is the highest power. It's the most reputable out of all of the trials that can be conducted. They showed strong evidence that people who used Invokana for 3.5 years with a high risk of cardiovascular disease, it may reduce the combined endpoint of cardiovascular mortality, non-fatal heart attack, and non-fatal stroke. So this trial showed that if someone has a high cardiovascular risk, that using Invokana can actually decrease those 3 things, the cardiovascular mortality, non-fatal heart attack, and non-fatal stroke. So interestingly enough, when they actually looked at the individual endpoints, it showed that there was no clinical significance. So grouped, yes, there was a clinical significance. The combined endpoint of all of those 3 things were significant, but when they really tore it apart, took them individually, there was no clinical significance. So you actually may be on this drug because your doctor knows maybe you're at a higher risk for cardiovascular disease. You have certain, maybe you're a smoker or you have a family history or whatever that may be. And they did find in this trial, through the Canvas trial, that it can actually decrease the combined endpoint of those 3 things. And also, going to Jardiance, if this is used with cardiovascular disease, it actually showed decreased hospitalizations due to heart failure, cardiovascular death, and overall death. So it seems like those 2 were studied, the Invokana and the Jardiance, in cardiovascular disease. And, your doctor might be putting you on those medications to have that little added benefit. Now, there was some weight loss shown to through the, as a class, this medication can cause a slight amount of weight loss, and that who knows if that's from the person adjusting their lifestyle, is it really from the drug. So that's something that they tout. I'm sure it's on the commercials that you might see some weight loss, some minimal weight loss here. And like I said, with any diabetes medication, you want to make sure that you are addressing lifestyle factors. So you're looking at your diet, you're looking at stress, and your exercise and activity, because you can take these medications and it's going to help, but to add another element to it and to really lower your A1C and your blood sugar to prevent complications down the road, you want to be incorporating some type of activity, and that can be walking, that can be yoga, or cycling. The recommendation for that is 30 minutes 5 days a week. Now, if you can't do that, try to split it up. So even if it's walking 10 minutes 3 times a day, keep yourself moving. Get maybe a pedometer or something that can track your steps. And even if you're going to and from the water cooler, that counts as steps. So really try to have a plan whenever you're on a medication like this, or if you have diabetes, make sure that you're addressing those factors, because that can really decrease your complication risk and increase your lifespan and your longevity. So I'd love to hear your feedback on this video. If you have any specific questions, I would love to address them. But again, if you do have any personal questions, make sure that you're asking your doctor or pharmacist. So thank you so much for being here, and I will talk to you guys soon.